Hi, my name is Nancy Bartlett. I'm a family nurse practitioner student at United States University. Today is December 8th, 2025. And for transparency, I'm going to do a 360 of the room. Again, travel nurse, borrowed the cath lab, which you've seen multiple times now. Snell chart for the assessment. All of my tools laid out that I'm going to use. Ceiling. And floor. And we're gonna sit right about there, I think. We're going to try and do most of this sitting just so for camera's sake. I may have to move it a little bit when we do like the Snell test and things like that. But so we're just going to get started. In a normal situation, you would ask the patient's full name, first and last name, but for educational purposes, we are only using initials. And before I do that, I just want to make sure that you understand we are recording this and it will be uploaded to YouTube for educational and grading purposes. Do I have your verbal consent to do so?
Yes.
Perfect. So for educational purposes, like I said, can I get your initials, please?
JB.
Great. JB, can you tell me where we are right now?
Lab.
Okay. And do you know today's date?
December 8th.
Okay. And why are you here?
An exam.
Perfect. And so patient is oriented to person, place, time, and situation. Speech is clear and attention is appropriate. The next thing I'm going to do is assess recent and remote memory. And so I have 3 words that I'm going to tell you, and when I tell them to you, I want you to repeat them back to me. So apple, penny, table.
Apple, penny, table.
Perfect. I want you to remember those because I'll be asking you for them again later in the exam, okay? Can you tell me what high school you attended?
Franklin Academy.
Perfect. So remote memory is intact. Next, I want to assess for reasoning and judgment. So I have a scenario for you. You're walking along and you find an envelope that's laying on the ground. You pick it up and it's fully addressed and stamped. What do you do with it?
Mail it.
So judgment and reasoning are appropriate. The first thing we're going to do is start with the cranial nerves, and so we're going to be assessing all 12 cranial nerves today. So the first one we're going to start with is cranial nerve 1, which is olfactory. And so I do have a couple of containers here, and I'm not sure if you can see that, but what I'm going to have you do is plug one of your nostrils and close your eyes and tell me what you smell.
Nutmeg.
Which is correct. That's nutmeg. And go ahead and plug the other nostril and tell me what you smell now.
Coffee.
Perfect. And that is also correct. It is coffee. And so next we're going to move on to cranial nerve 2, which is optic, and I'm going to start with confrontation. So I want you to look at my nose, and I want you to tell me when you can see my fingers.
Now.
So visual field is full and visual full with confrontation. So meaning his peripheral vision is intact. The next thing we're going to do is the Snell test, and I'm going to have you scoot your chair all the way back, and I'm going to see if I can turn this camera just enough so you can also see the, well, kind of see the patient, kind of not. I'll have you come into view, just perfect. And for educational purposes, he may not be quite 6 feet, but I am using a Snell pocket chart, which requires the patient to be 6 feet. But for camera purposes, we're going to be a little less. But could you please read the smallest line, hold the occluder to one of your eyes, perfect, and read the smallest line visible.
L, T, F, P, H.
Perfect. And can you swap that to the other eye and do it again?
L, T, F, P, H.
Perfect. And yep, take that down and read it with both.
L, T, F, P, H.
Great. So visual acuity is 20/20 bilaterally, which is a grossly normal exam. And I'm gonna scoot this back level again. Lay this down over here. The next thing I'm gonna do is I'm gonna do the fundoscopic exam. I am gonna remove my glasses for that. It's just easier for me. And what I want you to do is just pick a spot and look forward. I'm going to use one hand to put in your forehead, okay? And sorry, I'm getting nice, close, and personal. And I'm going to do it again on the other side. So, red reflex is present. I was able to follow the vascular centrally to the optic disc, which has sharp edges. I was able to recognize larger veins that are darker, lighter, smaller arteries. The macula is present and the foveal reflex is intact. So grossly normal exam. And that was for, again, optic nerve, cranial nerve to optic. The next thing I'm going to do is assess ocular, extraocular motor, extraocular movement with the eyes, which is going to assess cranial nerve 3, which is ocular, 4, trochlear, and 6, abducis. And so what I want you to do is just follow my finger. So ocular movement is present and symmetrical in all fields bilaterally, which is a normal finding. Next, I'm going to use my pen light, and I'm going to assess optic and ocular cranial nerves again, looking at at his pupils. So just pick a spot again, and so pupils are equal, round, reactive to light, and accommodate, and with direct consensual constriction present. That brings us to cranial nerve 5, trigeminal. And what I'm going to do is I have a long Q-tip, and I'm going to use both ends of the Q-tip for dull and sharp. And I'm going to have you close your eyes, and I'm going to touch different places on your face, and I want you to tell me if it's dull or sharp.
Dull. Sharp. Dull. Sharp. Dull. Sharp.
So sensation is symmetrical and intact bilaterally, which is a normal finding. I asked you to remember 3 words earlier. Can you tell me what those 3 words are?
Apple, I ate tape.
Great. So recent memory is also intact, which is a normal finding. Sorry, I have to think about it for a minute. Just did 5. Facial. Cranial nerve is the next cranial nerve that we're going to, which is cranial nerve 7. And the way that I'm going to assess that is I'm going to have you smile big and puff your cheeks out and raise your eyebrows. And so everything is symmetrical and coordinated, and intact, which is a normal finding. I want you to clench your chin. So masseter and temporalis is present and symmetrical, which is also a normal finding. That brings us to 8, which is vestibulotrochlear. And so the first thing I'm going to do is assess his hearing with the whisper test. And so I'm just going to kind of stand behind him, and I'm going to whisper a word.
Red.
And I'm going to go over to the other side and whisper another word.
Blue.
Great. So hearing is grossly intact. The next thing I'm going to do is the Weber test. And so what I'm going to do is tap this against the palm of my hand and place it on the top of your head. And you let me know where you hear the sound, okay?
Both ears.
Perfect. So Weber test is midline with no lateralization. The next thing I'm going to do is tap it and place it behind your ear. We're going to do one at a time, but we'll do both. And so when I tap it, I want you to tell me when you no longer hear it and when you hear, if or when you hear it again, okay?
Stop. Start.
Okay.
Stop. Start.
Great, so air conduction is greater than bone conduction, which is also a normal finding. Okay. Then I want to move to 9 and 10. Which is vagus and vagus and glossopharyngeal. And so the best way to assess that is I'm going to have you open your mouth and say ah. So soft palate is symmetrical and rises, and uvula is midline. And can you swallow for me? And so swallow is intact. And this is the point where I have a ruler that would normally be a tongue depressor. And for my patient's comfort, I am not going to elicit a gag reflex. But for educational purposes, if I were to do that, I would insert the tongue depressor gently touching the posterior pharyngeal wall to elicit that gag reflex. And that's what you would hope to have as a gag reflex, which would be a normal finding. So can you also push hard? Yep, with your tongue. Perfect. Strength looks equal bilaterally also, so that's also a normal finding for this. So then we're going to move on to cranial nerve 11, which is the spinal accessory. And so I'm just going to scoot up close to you, and I'm going to rest my hands on your shoulders, and can you shrug for me? Great. And gently, I'm just going to gently turn your head. Yep. And the other way. Great. So strength is equal and present bilaterally, which is a normal finding. And lastly, I think I did the tongue in the wrong place, but lastly, this is where I want to do the tongue in the cheek, is for cranial nerve 12, which is hypoglossal. So you're going to stick your tongue out for me, and tongue is midline, and now the tongue in the cheeks, which shows the strength is equal bilaterally. Little nervous. Okay. From here, we're going to move into assessing the musculature. So right now I'm just inspecting, and muscle and bone, muscle tone, not bone, tone looks normal. I don't see any tremors or any kind of unelicited movements, so that looks normal. The next thing that we're going to do is we're going to assess muscle strength. And so, like I said, we are sitting. So I want you to put your hands out like a T and resist. So that tested the deltoids, and put your arms in front of you and resist. And I'm going to push against you. So that's biceps and triceps. Grip my fingers. Great. And put your hands out. And now I'm going to try and squeeze your hand shut. Great. So that's finger abduction. So everything is 5 out of 5, which is, sorry, the hiccups, which is normal and equal bilaterally. Next, we're going to go to the lower extremity. And because we're sitting, hopefully you can see what I'm doing, but I'm going to have you move your hands for me. And I'm just going to place my hands on your thighs and press up against me. Great. And resist and now squeeze in. So that was hip flexion, abduction, and adduction. Next, I'm going to put my hands behind your calves, and I'm going to pull and then push against me. So that's hamstrings and quadriceps. And then you can't see his foot, but if you lift your foot, just so it's in the camera. Great. I'm just going to use one for educational purposes, but we would normally do both. And so I'm going to have you push and pull. And so that's dorsal and pedal flexion, which are also 5 out of 5, equal and symmetrical, which is a normal finding. The next thing we're going to do is we're going to start assessing sensation. And so I'm going to use, again, my Q-tip, and I'm going to have you close your eyes, and I want you to tell me if you feel dull or sharp sensation. And just go ahead and sit back. You can just relax and tell me.
Dull, sharp. Dull, sharp. Dull, sharp. Dull, sharp.
So sensation is intact and normal, bilaterally to both upper and lower extremities. next thing. I don't know, it'll come to me in a minute. I'm going to move on because I just can't think of it. I'm going to have you put your hands down on your lap, and I want you to tell me if you feel one or two sensations.
2, 1, 1, 2.
So, 2-point discrimination is intact. Joints. I'm going to take your hand, and I want you to close your eyes, and I'm going to put my hand on the side, and I want you to tell me which direction you think the joint is going.
Up, down. Up, down.
And can I have a foot? And tell me.
Up, down.
The other foot.
Down, up.
Perfect. So joint position is present. I have an object, and I would like for you to, give me your hand. And I'm going to put this object in your hand, and I want you to tell me what it is without using your vision.
Key.
Great. That's exactly right. And again, I'm going to take your hand, and I want you to close your eyes. And I'm going to draw something in your hand, and you tell me what it is.
3.
Perfect. So, stegonosis and graphinethesis is present. Yowza. Those are hard words. Where I'm at. I don't know, I can't remember where I was, so I know that I need to assess your gait. Oh, no, I remember now. Okay, so I'm going to hold my finger out, and I'm going to have you touch my finger and then to your nose. Okay, so finger, nose, and I want you to do it with each arm. Okay, so go ahead. And again. Okay. Instructions weren't clear, and that's on me. I want you to use one arm first, and I'm going to move it around, and I want you finger to nose, and let's start with your right arm first, okay? So finger, nose, and now your left. Finger, nose. Great. And now, I'm not sure if you can see, but he's going to I want you to take your heel of one leg, one foot, and down your shin to your, and do it on the other one. From the bottom of the knee down to your ankle. So finger, nose, heel, shin, coordination is intact, which is a normal finding. And I know I'm missing something, but I just can't think of what it is. So I'm going to have you go ahead and stand up. And I'm going to assess gait, so if you wouldn't mind taking a few steps forward and back. So gait is steady and coordinated. So the next thing I want you to do is, I'm going to tilt this camera just a little bit, heel to toe, heel to toe, like you're walking on a tightrope. Great. And you can come back and stand. So tandem walk is normal. I want you to put your feet together and hands at your your side, and now I want you to close your eyes and just stand there for a minute. Yep. So Romberg's is negative, which is a normal finding. And lastly, I want you to put your hands out, palms up, close your eyes, and stand. And no pronation is noted, which is a normal finding. And that concludes our neuro exam.